You're welcome to the program Health and Wellness on Oweleketv. I am Antonia Nwokolo, and I'm super excited to have you join today's episode. Today, we are diving into a topic that's very crucial for every woman's health. We'll be talking about fibroids. Fibroids are non-cancerous growths that develop in or around the womb, and these growths are made up of muscle, fibrous tissue, and they vary in size. Many women are unaware that they have fibroids because they may not have any symptoms. So, in this episode of Health and Wellness, we'll look at why fibroids develop, the symptoms, treatment, and so much more. We are joined by a medical doctor and a reproductive health expert who is also an author and founder of a wellness company called Fertility Code Naturals. Our guest today is Dr. Gilbert Naji. You're welcome to the program, Doctor.
Thank you. Good to be here again.
It's good to have you here in the studio. So, Doctor, tell us, how does fibroid develop?
How does fibroid develop?
Yeah.
Okay. First off, fibroid is a benign tumor, like you already said. Benign tumor of the uterus or the endometrium. Okay. So fibroids has causes. Okay. The development come from the causes, the root causes. So medically, one of the causes of fibroid is genetic. Okay. It could be genetically linked. Okay. Let's say if someone's mom had fibroid, most likely the daughter could also come down with fibroid. That's what I mean by genetic. It could be passed on from a parent to an offspring. That's number one. And then number two, it could be hormonally linked too. For instance, when there's elevated estrogen hormone, estrogen hormone is the female dominant hormone. So when the estrogen hormone is abnormally elevated in the body of the female, fibroid is most likely going to grow out from that uterus. Okay, this is just medical facts. Okay, so estrogen is linked to fibroid growth because that is what actually fuels fibroid to grow. For example, when a woman reaches the age of 40 and above, that's the menopausal age, 45, if she had fibroid will stop growing because that's when the estrogen hormone also plummets, that regresses drastically. By
Okay.
the age of 45, the estrogen hormone will become so low. So it means that what the thing that feeds the fibroid will not become non-existent. Okay. So the third cause of that challenge is environmental factors. Environmental factors like, let's say, toxins around the environment, that in certain substances that women taking into their bodies, maybe from food, unhealthy food sources, for example, that has, because those toxins has resemblance to what they call synthetic hormones. They have synthetic hormones resemblance. What is known as xenohormones currently, what they call xenohormones are some certain chemicals that looks exactly like the human estrogen. So when we consume those substances, okay, in form of foods, the body sees them. They look like estrogen in the body, so they multiply in their quantity, increasing the load of estrogen and then causing those growths in the uterus known as fibroid. So these are typically the causes of fibroid: genetics, hormones, and environmental factors.
Okay. So, what are the common symptoms of fibroids? How does one know that, oh, you have fibroid, and how can it impact a person's health?
Okay, fibroid has hallmark symptoms. One of them is irregular menstrual cycle, which also comes with prolonged period. Okay, excessive bleeding. So when the woman suddenly begins to experience that she's bleeding excessively, period is more than 5 days, more than 3 days, she should go out and see a doctor for her to be examined. That is number one symptom. On the other hand, too, discomfort, lower abdominal pain too. Women can have lower abdominal pain. Okay, that's for a complicated fibroid. It causes some level of pain. And sometimes when the woman is not having sex, she could complain of painful sex. It's called dyspareunia in medicine. So these symptoms, tell the woman that okay, something's wrong with my body. Let me go and get evaluation. She can also do a scan. Okay, she should do a scan, a pelvic scan, to also check out to know if her uterus is okay. You can also review the presence of fibroid. And then lastly, if that lady is married and she's not conceiving, that is ultimately one telltale sign of fibroid. And then she has to see a medical doctor or a fertility expert to get properly assessed, find out what could be wrong with her. So yes, fibroid has symptoms. These are the signs and symptoms of uterine fibroids that generally women should know about.
How does fibroid affect fertility? Are there special considerations for women trying to conceive with fibroids?
How does fibroid affect fertility?
Yes, how does
Okay,
it affect?
and there are actually specifically four kinds of fibroids. Okay, now the reason why fibroid affects fertility is because of the location of the fibroid. That's why they have types. Like we have five types of fibroid. Number one is called pedunculated fibroid. It grows outside the uterus, like a stalk. The other one is called submucous fibroid. Submucous fibroid grows, underneath the uterine cavity. It bulges into the uterine cavity. That's actually the one that actually hinders conception. But I will come back to that. The third one is called intramural fibroid. It grows in the midline of the endometrium. Okay, and then the other one is called subserosal. Subserosal grows some outside the womb. But then the other one, the one that actually causes infertility, is the one called submucous fibroid, because it competes with the implantation of an embryo. Okay, so and then when that happens, there is this hustle to get blood supply. Because of that surface level of that fibroid, it doesn't really allow that embryo to implant and grow, because the embryo should implant in the cavity of the uterus to get blood supply and nutrients. So the fibroid competes with it because it's like a living thing too. It gets blood supply from the human body and get estrogen and the baby to also need all those things. So it competes. So whenever you have a fibroid causing infertility, know that that fibroid is located at the submucous layer of the womb. And then secondly, if the fibroid is a migratory one, let's say it's around the entrance into the fallopian tube, because the way the female uterus is being structured, there are two fallopian tubes extending outwards, connecting the ovaries. So if the fibroid is occluding where the male sperm should swim to meet with the female egg, it's going to be a challenge. So it's a positional problem. That is what actually affects conception for many women. And then another one is the size too. If the size is negligible, let's say 2 centimeters or 3 centimeters, it won't really be a problem. But when it begins to exceed, like let's say from 6 centimeters and above, that is when doctors say you come and do surgery. Okay, so it does affect fertility according to what I just explained.
Okay, so what treatment options are available for managing fibroids? Both non-invasive,
Okay,
surgical, natural. What treatment options are available?
okay, there are basically three categories of treatments for uterine fibroids. The first category is the medical approach, in which uh, this woman the woman that has fibroid will be given hormonal drugs, to help to control the irregular menstrual cycle condition. And then if the person has pains, it's more like a conservative treatment. If the woman also has pains, she should be given what is called NSAIDs, like anti-inflammatory medication to help deal with pain. And then she can also be given some what they call hormonal agonists that will help to suppress. But this one is not what you can get over the counter. She has to see a fertility doctor
And you
to
prescribe
prescribe
first.
that. It actually helps to shrink the fibroid, and we use it in the IVF settings. Woman that has massive fibroid, let's say from 4 centimeters and above, if she's given this injection for let's say for up to three courses or two, it helps to regress the fibroid growth remarkably. So I've had that experience with my clients, so it works pretty okay. Then the second category is the surgical approach. It is when the fibroid has become problematic, because of the size. So that lady could be booked for what they call myomectomy, the removal of the fibroid. Surgeon goes into the uterus and then isolates the particular fibroid and remove the fibroid, causing the problem. That is one type of surgery. Another one is called hysterectomy. If it has actually ravaged the whole uterus, the fibroid has messed up everywhere, and then there's nothing else could be done, and then everything could be removed,
Removed.
yanked off the uterus.
Wow.
So such treatment, the after effect now there'll be no chances of conception. So
Oh,
usually it is advised that women should seek help early enough when they begin to to experience the symptoms of fibroid. Okay, normally I would even advise once a year one should go for annual medical check, and she should include pelvic scan. It should be compulsory because this thing is something that is prevalent in Africa.
Yes, and it also affects a lot of young women that may not even be married yet.
Yes, yes,
And I've seen lots of videos on social media where
yes.
someone says, "Oh, I noticed my tummy was protruding, and then when I went to the hospital, my period was I was having irregular menstrual cycle,
true.
and when I went to the hospital, they found out it was fibroid." And you're like, from where to where? How did I get fibroid? Before, over the years, we used to think that fibroid was for, it affected certain categories of women, maybe from 40 thereabouts, but now we see ladies in their late 20s, in their early 30s having fibroids. So, doctor, are there other advancements or technology that have come on board to improve fibroid diagnosis apart from this annual medical checkup? Are there other technological improvements in diagnosing fibroids?
Okay, I think yes, there are quite some new advancement that came in newly for treatment of fibroid. One of them is what they call laparoscopic surgery, like an instrument to be passed in that has a light source and camera be passing through the abdominal wall, to kind of suck out those fibroids, more like grind it and suck it out, but it to be monitored via a computer.
Okay.
So why the reason for that procedure is to actually reduce, minimize the invasion.
Okay.
Because when someone wants to go in for surgery or fibroid myomectomy, the person will be incised now, so that will create an environment, an incision environment, and then to reduce that and to prevent what is called to prevent this scar tissue from forming and adhesions. The pinhole, it's called pinhole surgery. It's very recommended, but it's expensive. It's not
It's
as
not cheap.
affordable as the other ones. It costs millions of naira, so that's the side effect. But it's also okay. I didn't want to mention the natural approach. There's also a natural approach for fibroid,
Oh,
and it's hopeful. People are getting results. Okay, remedies like turmeric. It's good for turmeric. Has
wow.
Yes, it has anti-estrogen effects. Yes, it's on research. We've checked it out. It's actually very effective. It has anti-estrogen and the fiber helps to reduce estrogen level in the body. So when that is done, it also helps to stop fibroid growth. Even vitamin D too. Okay, I was going through medical information recently, and I saw that vitamin D is also a remedy that can also help fibroid to reduce. So these are effective means because women shouldn't be in the dark anymore. If you have fibroid, you want to just stay, don't do anything. No, you can do something. You can detoxify estrogen in your body because that is the root cause of one of the root causes is elevated estrogen. You can detoxify using these remedies I mentioned, turmeric, and then also get to adopt healthy lifestyle. Very, very important because most time these things coming from the way we eat, what we eat, the kind of food we consume, and then what we don't also eat and what we eat. So that comes in the place of nutrition. What are you eating? Fatty diet, it's not too good. Okay, fast, all these canned foods, not too good because whatever that contains so much of fat will increase fibroid growth because fat is a precursor for hormones production in the body. Okay, so you see, a woman that doesn't have the adequate weight, she will have a hard time making estrogen. But estrogen is what fat produces. Okay, so the woman should be mindful the kind of fat she consumes. And then when it comes to the kind of food to eat, high fiber diet is very good. It helps to debulk too much of estrogen in the body. And then another thing that the woman should do to also help to manage the fibroid is to eat what they call cruciferous vegetables. Things like kale, cabbage. They help to mop up too much of estrogen in the body. Okay, especially in the liver. Okay, it helps to mop up those toxins. So these approaches are very useful. They help to manage fibroid condition and to also because it's a very stubborn tumor. If one wants to approach it the natural way, that's why most women are told to go for surgery.
Surgery directly.
Yes, they're told to go for surgery. So that's the way to handle this fibroid issue.
Okay, so what if a lady says, I've been diagnosed with fibroid and I don't want to take any treatments? What are there complications that may come up later on if someone chooses not to treat fibroids, whether naturally or surgically? Are there complications that may arise?
Yes, there could be complications. Like recently, I was going through one information on my mobile device, and I noticed one prominent public figure. You should know about her, the former DJ of NAFDAC, Mrs. Dora Akonyili.
Okoyele.
Yes, this from the son's mother. She said her mom died from fibroid complications. They actually became cancerous, and it happens, but it's not common. And that should be a primary case that I've heard that someone died from fibroid complication, because fibroid can become cancerous if nothing is done about it. Although it's not very common, but in certain people it can become cancerous. So it's not advisable for a woman to do nothing if her fibroid has gotten to the limit whereby she has to see a medical doctor for other surgical solution or other approaches of treatment. So it has has consequences if nothing is done. So a lady that has fibroid can begin with good lifestyle habits.
Changing her lifestyle.
Absolutely. Then your intake, your dietary intake, you begin to change the things you eat and also embark on healthy dieting. It helps a lot, but it's a gradual process because it's a tough, stubborn tumor. So getting healed from fibroid or getting solution, it's a step by step approach. Unless the person wants to go for surgery, but surgery is not actually the best thing to do unless it becomes complicated, like it's causing the woman bleeding. Okay, so that's the way forward.
Thank you so much, Doctor. That's the much we can take on this program. It was wonderful having you here in the studio.
Thank
I really
you.
appreciate your presence.
Thank you.
So that's the much we can take on today's episode. Thank you so much for watching. Don't forget to hit that like button, subscribe to our YouTube channel, and kindly follow us on all our social media platforms at Oweleketv. Our website is www.oweleketv.tv. My name is Antonia Wokolo. See you in the next episode.